कारमेषां विविधौषधीनाम् ॐ शान्ति शान्ति शान्ति. Friends, ancient Indian culture has always respected women. Yatra naryastu pujyante ramante tatra devata. Yatra etastu na pujyante sarvastatra vifala kriya. So wherever the women are not respected, everything is wasted. Nothing is fruitful. Indeed, friends, may I request all the participants to kindly mute yourself so that there is no disturbance. Indeed, the health and the status of a society is indicated by the health and the status of the woman residing there. Michelle Obama reflects these very thoughts when she says that communities, countries, and ultimately the world are only as strong as the health of the woman belonging to the world. We friends, as practitioners of Prasuti Tantra and 𝘼𝙎𝙍𝙬𝙬, are indeed privileged to have an opportunity to serve women. NEMA-OBGY Society is doing a wonderful job by supporting budding talent in our field. National Integrated Medical Association, or NEMA as we know it, was established on 13th of April 1948, and since its inception, it has been working tirelessly for the protection of the rights of Indian system of medicine graduates. NEMA-OBGY Society was founded to impart education and support and protect the character, status, and the interests of the integrated medical profession in general and of the practitioners of 𝘼𝙎𝙍𝙬 and Prasuti Tantra, that is integrated obs and gynec in India. By organizing this webinar bonanza series, NEMA-OBGY is furthering its objective of fostering education in the subjects of integrated obs and gynec. An army marches on its stomach, friends. Without food, the army cannot progress. And similarly, an organization flourishes on funds. So hereby I take this opportunity to request all the members of the OBGY group to register themselves officially by using the link provided earlier in the group and paying the membership fees at the earliest. Today, friends, we are having with us none other than the very knowledgeable and experienced Dr. 𝘼𝙎𝙍𝙬𝙬 Madam, the head of the Department of PTSR at ITRA and also the ex-dean of IPGTR and A. Madam is a PhD in PTSR and has 30 years experience in teaching, out of which 16 years is for the PG teaching. She has authored the content of online e-learning course for foreign medical professionals titled Common Gynecological Problems and its Non-Hormonal Ayurvedic Management. Madam was a member of several research projects conducted in Jamnagar. Over the years, Madam has guided around 30 MD projects and 20 PhD scholars. She has published over 100 articles in peer-reviewed journals. She has contributed 4 chapters to various books, has attended several national and international conferences, and is the member of no less than 13 boards related to education and women's health. 𝘼𝙎𝙍𝙬𝙬 Madam has also worked as a resource person and a chairperson in various national and international seminars. Before we begin this lecture, I request you all to mute your mics and your phones so that the dignity of the session is maintained and disturbance is avoided. And now, without taking much more of your time, I request 𝘼𝙎𝙍𝙬𝙬 Madam to begin her guest speech. Over to you, ma'am.
Video. My slides are visible. Am I audible, madam?
Yes, madam, you're audible and the slide is also visible.
Okay. Okay, thank you. Thank you. So good evening to all of you. Om Shri Jagannathaya Namaha. Om Shri Dhanvantaraya Namaha. Om Gurave Namaha. Really, it is my great pleasure and a honor to the NIMA OBG Society Central that giving me such an opportunity in this platform to share a little bit my thoughts to the such a august audience related to Prasuti and Stiro. Respected my dear president of the NIMA, that is Kamini Dhiman madam. She is also product of this IPGT and RA. And the secretary, that is Priyanka Nakde. Then from the members of the Gujarat, that is the Manjusa Karkare, then Neha Parasar, Vishnu Bhavane, Rajesh Uttane, and all the members, PG, PhD, scholars, physicians, and the faculty members, those are connected online to this NIMA OBG Society Central webinar on the topic. It is the 7th national webinar on 𝘎𝑚 within the purview of Avarana, a evidence-based approach. It is very sincere request, please mute all your mobiles, otherwise it will not clear. There may be the disturbance. So thank you. Thank you the giving such a introductory regarding me. I am not like that. I am just a student and just a learner like all the students. Because Ayurveda and the Prasuti Strirog branch is so vast that to collect simple sand, it is very difficult. And throughout life it will be. So it is, I think, 𝘎𝑚 is a very common topic. And all the gynecologists, they come across in their practices in OPD, in IPD, or even in the family also, and sometimes the neighbors. So it is, though it is a very common topic, but still now we can say in Ayurveda also, in modern also, we cannot tell that this type of treatment protocol or this medicine can permanently cure the 𝘎𝑚 or the heavy menstrual bleeding or irregular bleeding or either menorrhagia, metrorrhagia or abnormal uterine bleeding. So it is very a challenge. And I think why? Because if it is a surgical, then we can, lastly, what we are advising all the modern doctors, that advising that they do the hysterectomy. So hysterectomy, if we say that when we have to do the hysterectomy, that 𝘼𝙎𝙍𝑉𝑖𝑠 𝑠hraya-garbhasya patanam, just as Sushrut has been told. So in which case there is the disease is two types according to the management by the Sushruta. That one is the Snehadi Siddha and another is the Shastra Sadhya. So Snehadi Sadhya, that means by the Panchkarma and by the medicine or conservative treatment and by the surgical. And when we are doing with the surgical diseases like our this Granthi, Apache or Buddha, all these things, so it may comes under the surgical. In that case, we need the surgery, but unnecessarily there are so many causes for this hormonal disturbance. So it is also causing this abnormal uterine bleeding, and when the doctor is not success by giving so many hormonal pills, then they are advising for the hysterectomy. And so many times also there is therapeutically this endometrial biopsy also taken, and therapeutically that is the DNC also doing, but still then there is no success. So what is behind it? Why you have not success? So I think so many times, and when we will go through this Susru Samhita, that is the Nidan Sthana first chapter, that is Avranajanya Vyadhi. So there are so many Avranajanya Vyadhi, and Asrukdar is also a Pitta Bruta Apana, that is the Pitta is Avrana, the Apana Vayu is Avrana by the besetted Pitta, which is creating this Asrukdar. So, and now modern in gynecologists, they are also focusing to the pelvic congestion syndrome, which is now is an emerging cause for the abnormal uterine bleeding. So this pelvic congestion syndrome, if we see the similarity, then it may be nothing but the Pitta Bruta Apana Lakshana. So if we can clear, then really which are the functional Asrukdara, then we can cure the patient, and we can save the so many the unnecessary the spend of the money and unnecessary the pain and the strain to the patient also. So for the public benefit, it is very, very essential to focus on this. And when the students, their patient, we are coming to the OPD, first of all, we are giving the styptic, and all the Grahi and this Rakta Stambhaka, they are not giving the result. So then and then, if we think that there will be Avrana Janya Vyadhi, this may be the Avrana Janya, if there will no any structural incidents or structural the findings, then we can think over it. And if we do, and really up to the 1 year I am doing this type of work, that if we are giving some laxative, some Vatanuloman, along with some Pitta Samaka, then the Mutrala drugs, then it is giving the good result. And even so many disease also giving the complications, like if this typhoid medicines when we are taking, or any this anti sometime for the febrile condition when we are taking the PCM also, it is also giving the this Asrukdara, and sometimes this high BP and liver disorders, spleen disorders, it is also ends with the leading cause for the Asrukdara. In these cases, or the hormonal disturbance case, we can get very good results in this. So that's why I think that I should share my thoughts to all the audience, so that they can also use this principle or this prescription in their day-to-day practice, and it will be give the benefit to the patient also. So let us start. So everybody know the definition and the synonyms of the Asrukdara. That we should think that is the two things, Asruk Dirjate Chabat. So Dirjate and Chabat, they are two things. Dirjate, that means the discharge or excessive bleeding. But Chabate, that means it is the forcefully. It is. I don't know whatever the disturbances are coming. So this is the chabate. That means it is the forcefully pulling the blood from the blood vessels, and there is the discharge. So it may be, so that is giving some idea. There will be more congestion in the reproductive organ or in uterus, so that there will be the more discharge and more the pooling of the blood, just like during this diarrhea. Then what is happening, there is the fluid is just pooling to the intestine, and it is the coming as a stool, watery stool. So similarly, so if you think that it is the more congestion in the reproductive organs or the pelvic organs, so that there is the pooling, or so that may be, it may be the thickening of the this endometrium, or it may be, there may be that because this Vyana, it is the responsible for the discharge of the blood or the bleeding, and for the Svedasrava, or for the sweating. So if there will be, we are thinking that there may be coagulating factor, according to modern coagulating factor, there may be the liver disorder also. But why this liver disorder? There may be high BP, but why this? If we think that is the, in Ayurveda, there is mentioning of the 𝘼𝙎𝙍𝙖, that this is also one of the cause for the 𝘎𝑠rugdha repeating. So if we think that is how this 𝘎𝑠𝑎𝑠𝑖, it is the responsible for the creating the disease like 𝘎𝑠rugdha. So if we see, that is the artavam sonitam. And from this sonita, from this matrujbhava, from this sonita, this blood, what is the first organ which is forming? That is the hrudaya, or the heart, which is from the FCP. We are knowing that this heart is, so FCP is present, so she is the conceivant. So first organ it is. And then from the hrudaya, there is the jakrut, pliha, phupusa, and then garbhasaya also there. So these organs, they have interlinked. So if there will be any cardiac disorder, so it may be, there may be high BP. So this high BP can create this menorrhagia also, what we are seeing. And then this liver disorder also, we are, because due to this 𝘎𝑠𝑎𝑦-bhava, the interlink, so that is the main cause for the 𝘎𝑠rugdha. And if we break the chain, then we can cure the disease. So everybody know that it may be the Raja Pradijate Jasmat Pradarsa Smuta. So I think that all those are involved in this seminar, all are, they belongs to gynecology family. So they all know, so there is no need to unnecessary time waste. They're giving this introduction about the 𝘎𝑠rugdha, the definition. But everybody know that is the तमेव अति प्रसंगेन प्रवृत्तम न ऋतुव्यापी. That is, it may be the excessive bleeding or the high menstruation during the period, or there may be the intermenstrual bleeding, or any type of bleeding, any time of the bleeding from this vaginal canal, which is known as the 𝘎𝑠rugdha. And this is also called as the Raktjoni. So 𝘎𝑠rugdha, so it is two types, that is pradara. One is the 𝘎𝑠rugdha and one is the Shwet pradara. So, and if it is the, means time duration is less, then also we can tell that is the early menses, and the quantity is more and the duration is more. So which we can diagnose the quantity, that is using the thick pads, number of pads are more, and the duration which is mentioned. That is more than the 5 to 7 days. Then we can call also. Silence, please. It is my sincere request. So 𝘎𝑠rugdha explains about the prolonged, frequent, and excessive menstrual bleeding according to Ayurveda. And if we see the importance that is from the various reports, we know that the 30 to 50% of the women in reproductive age group suffer from the excessive and irregular uterine bleeding. In India, the prevalence is the abnormal uterine bleeding around the 17.9%, and over 8 lakhs of women seek help for the AV annually worldwide. Then 10% of the employed women, they need to take off or the leave from the work because of the excessive menstrual loss, and 60% women of the EV have to go for the hysterectomy in the next 5 years. So the hormonal intervention, and we should know that this hormonal intervention and this estrogen, it is weakening the vein, and which is creating the congestion, and that is the varicose veins, and it is also the pelvic, creating the pelvic congestion, which is once again responsible for the 𝘼𝙎𝙍𝙍. And it can also create the anemia due to the excessive blood loss. So according to the FIGO classification system 2022, that is the abnormal uterine bleeding or the heavy menstrual bleeding and the intermenstrual bleeding, it has the mainly two causes, that is the palm coin. That is, palm means it is the structural, that is palm means P for polyp, adenomyosis A, then L for the leiomyoma or the fibroid, and M for the malignancy and hyperplasia. Then non-structural, which we can take in Ayurveda, that means the which can causes the congestion in the pelvic cavity, that is the coagulopathy also, and there is the ovulatory dysfunction, then the endometrial dysfunction, then iatrogenic, and not yet the classified. So for this structural, there is the surgical treatment is needed, but the coin, that is the non-structural entities, which is near about the 40%, we can deal this Ayurvedic area, we can strengthen, we are the strengthening area of our treatment, and we can deal with very nicely. So 𝘼𝙎𝙍𝙍, there is the endometrial hyperplasia. In hyperplasia, if we go through this our USC report, then we can see that is the endometrial thickness is the more, and then it is the adenomyosis and the endometrial polyp also one of the cause, and there may be the polyp, it is the multiple polyps or fibroid polyps, or sometimes the polyp is too weak that it is coming through the cervical canal, and due to the polyp laceration, there is the heavy excessive bleeding. Then the fibroid, and there is incomplete abortion. It is the USG finding. If we see this, the incomplete abortion is like this, and then the small polyps, multiple polyps, then the dysfunctional uterine bleeding, and the adenomyosis. So if we see in the adenomyosis, always in maximum we have seen the posterior wall of the uterus, and if you see the USG, then we can see this is the irregular thickness of the anterior and posterior, and the posterior is more thickened than that of the anterior also. Then if you see the 𝘼𝙎𝙍𝙍 under the umbrella, then the joni vyapatas like Ashruja joni vyapat, Rakta joni, then Lohita khyara, Pittaja joni vyapat, then the it is also the complication of the joni vyapat also, which is mentioned, and also there is Putragni and the Udavartini. So Putragni, it is the habitual abortion which you are taking. So in Putragni case, there may be the followed by the abortion followed by the this 𝘼𝙎𝙍𝙍 and then Udavartini. So how can we can say that this Udavartini can create the 𝘼𝙎𝙍𝙍? If we see that is due to the Begdharana, so there is the upward or the retrograde menstruation, and due to this retrograde menstruation, the complication is endometriosis or endometriosis and adenomyosis. And adenomyosis, it is the main cause for the 𝘼𝙎𝙍𝙍 also. And then 𝘼𝙎𝙍𝙖, we have already been discussed about the 𝘼𝙎𝙍𝙖, that is how this high BP can cause the excessive bleeding and the liver disorder, then the spleen disorder, and even the lungs disorders also. So everybody know about these types of the 𝘼𝙎𝙍 which has been mentioned. It is very common that the BMS student can also say. But if we compare, that is the 𝑽𝑎𝑡𝑎, how can you treat? Maybe the irregular and with the pain. But when we see the pitta, then it is the excessive bleeding, and a menometrorrhagia can occur, and even the pelvic congestion symptom, and the inflammation also, even the paripluta Yoni-Vapot symptoms can also sometimes you can see, and it is the very acute condition. Then in 𝑘𝑝ℎ, that may be the maximally we can get the endometrial hyperplasia. Sannipathash, there may be the carcinoma, there may be the endometrial or cervical carcinoma maximum we are getting. So if you see the that is the dosic predominance, then it may be the pitta-bhrutapana, it may be the rakta-pradoshaj-vyadhi, it may be the complications of any other disease, because roga rogasya upadayate. So rakta-pradoshaj-vyadhi, if we see, because this raktantargata pitta and pittantargata agni, and all are controlled by the vayu. So this is the rakta-pradoshaj, the disease which are the mentioned in our classics. That is the Vakhyante rakta-pradoshajah, kushtha, visarpa, pidaka, rakta-pittam, asrugdar. Rakta-pitta also cause of the asrugdar. And this asrugdar can cause the rakta-pitta, rakta-pitta can cause the asrugdar. It is the vice versa. Then prameha pradara atinidrascha rakta-pradoshajah. So this rakta-pradara, it is the rakta-pradoshaj-vyadhi. And again, that is the sukradosha pramehasto vyana apana prakopaja. So which is mentioned by our Susruta, that is sukradosha pramehasto. So in case of the female, we can take the artavadosha pramehasto vyana apana prakopaja. So our the endometrium, that is the hypothalamic pituitary ovarian endometrial axis, it is the control by our this vyana. And when it is the in ovarian function and the endometrial function, it is controlled by the combined effort of the vyana and apana. If it is any derangement, so it can cause the excessive bleeding, either during the menorrhagia or metrorrhagia. So it can also occur during the upadrava of this asrugdara, as the after the Yoni-Vapot and the dusprajata, that is the obstructed labor also. So, and one more thing, that if we, so what is the relationship between the asrugdar, its etiopathogenesis, that is avarana, pitta-bhruta apana, that is pelvic congestion syndrome. So when we see, this is the Nidan Sthana, first chapter of the Susruta Samhita, then we can get when the vitiated vayu, it is incited to the dhatus, then what are the diseases are developing? That is the, if it is the sukragate anila, in case of the female, you can take the artavagate anila. So if the vitiated vayu, it is incited in artava or artava srotas, then what is happening? That is apravritti. It may be create the amenorrhea or pravrittiva or excessive bleeding or vikruti. So in three symptoms we can get either amenorrhea, either the means vikruti means it may be painful, or irregular. So vikruti and pravrittiva. So it may be, it causes the excessive bleeding or the asrugdar also. And if we see, that is the role of the apana vayu, it is the site is the pakwadhana gudalaya apana kale karsati mutra purisa asru garbha artava Shukra, etc. So everybody know. So if Kale Karsati, that is, it is the monthly cycle or the periodic, it will be, there will be discharge, timely discharge with quantity also, the normal quantity within this normal limit. But if it is untimely, that means it is the irregular or intermenstrual, there will be discharge of this artaba or bleeding or blood. So then we can call it as the asrugdara, and due to this it is vitiation of the apanavayu. So apanavayu, it can control, it is controlling the whole the reproductive organ function, and if the derangement of apanavayu, it can create all the diseases. So again, the Charak and the Sushruta both are telling that this is the symptom, that is the Pitta Bruta Apana system, Rajasya Ativartanam. Rajasya Ativartanam. So periodical bleeding or the menorrhagia, it is occurring due to this Pitta Bruta Apana as per the Charaka. And if we see the Susruta, that Apana Pitta Sanjukte Daha Usna Sat Asrukta. So he is directly telling that it is the Apana Pitta Sanjukte Daha Usna Sat Asrukta. Daha Usna. There may be the general features of the Paitika features. It may be Daha or the burning sensation. Usna may be fever, and we have seen also fever also causing this Asrukdar or the AV also. So that's why it has been the Sukradosha Pramihastu Vyana Apana Prakopaja. So if you see, that is how it, we can say that is it is the Avranajanya Vyadhi or the pelvic congestion. So if you see, that is the causative factor and the etiopathogenesis for this Asrugdar, that we see, that is Ja Atyartha Sevatanari Lavanamla Gurunicha Katuni Atha Vidahini Snigdhani Pisitani cha Gramya Udakani Medhyani Kusara Payasudadi Sukta Mastu Suradinam Bhajantya Kupito Anilaha. Then we are seeing that all the dietary defective diet, it is the pitta vitiated diet. So how can it will be create the Kupito Anila? It can create the Kupito Pitta. But how it is creating? But very, it is the hidden treasure, or it is the latent heat or latent cause, that this pitta or the vitiated pitta, due to this avarana, it is the creating the kupito anila. So very, if we go through and thought of it, then we can know that is it is nothing but it is due to this avarana, there will be kupito anila. And this, when kupito anila, if it is occurring, the vayu is vitiated, then what is happening? Jadato kupito vayu swasira pratipadyate tada asya vividha rogaha jayante vata sambhava. So vata vitiated disorders is occurring in the circulatory system, and it is the pelvic organ. So in this pelvic circulation, there may be congestion, so there may be the excessive bleeding. That is, you see, we see that is the kupito anila. What is happening? That kupito anila rakta, what it is doing? The rakta pramanam utkramya. What it is doing? That it is rakta pramanam utkramya garbhasaya gatasira rajo bahasamasrita raktam adaya tatraja. That it is just excessive circulation is towards the Garbhasaya Gatasira. So Garbhasaya Gatasira, if we see, that is the uterine vessel, and the ovarian vessels are the giving the blood circulation to the this reproductive organs. So when Rakta Pramanam Utramya, so it is the creating the Pramanam Utramya to Garbhasaya Gatasira. So it is the creating, Garbhasaya Gatasira means endometrial vessels. So it is creating the proliferation, more proliferation or thickening to the proliferation of the endometrium, which is creating the more shedding and a more bleeding, which can we correlate with the pelvic congestion syndrome, that is the Raktantargata Pitta. So 𝘼𝙎𝙍𝙖 we know that is 𝘼𝙎𝙍𝙖 प्रविसृज्यते पुष्पे भूतं हि तदेव मासि मासि प्रवर्तते. So it is the function of the 𝘼𝙎𝙍, and if there is the excess the circulation or the congestion to this garbhasaya 𝘼𝙎𝙍, then there will be excessive bleeding, which we can take as the dysfunctional uterine bleeding or abnormal uterine bleeding. And one more thing, that is other causes also this we see, that is the viruddha matya, atyasana, ajirna, garbhaprapata, ati maithuna, jana, that is the excessive, that is the jerking vehicles using, and the soka, that is the manasika bhavas. So manasika bhavas, that is the rasavahini dusyanti chintanam ati chintanat. Everybody knows it. That is due to the psychological factors also, that it is also the rasa dhatu and a rasavahini dusyanti. So this is the raja, it is the upadhatu of the ras dhatu, and due to the psychological factor, then when the ras dhatu is visited, then again the raja is also visited and stanya is visited. So that's why it is creating the excessive bleeding also, and abhighata. So there may be the trauma, and due to the excessive sexual act also, it is also one of the cause that is creating the excessive congestion. And divaswapna excess, it is also one of the most causes of the vitiation of the direct vitiate the blood. So this is the pelvic congestion and the asrugdar, that is a pitta prakopajanya ahar vihara, and due to pitta prakopajanya there is pitta prakopa and avrana of the apanavayu. So there is the pelvic congestion, and due to this congestion there is the congestion in the garbhasaya gata sira, and there will be the asrugdar. So this is the pelvic congestion syndrome in modern, and we can correlate it now from the Ayurvedic side we have already been discussed. So come to the modern point of view. So this is the pelvic congestion syndrome, is a medical condition in women caused by the varicose veins in the lower abdomen or the pelvic cavity. Exact cause of the pelvic congestion syndrome, though it is not known, but the possible causes may be the estrogen is the causative factor, which can weaken the vein walls, that is the in pathological condition, that is the taking the excessive exogenous estrogen, that now the chicken taking the plentifully by these adolescent girls and the ladies also. If you just see that before it in traditionally there is the one guideline that the ladies should not take the chicken, can take the mutton and the fish also, but not for the chicken. It is a sukrala, and it is telling us the male should take. It is just like giving that if you take the chicken by these ladies, then our forefathers will not take, that is the sraddha. So though it is a holistic approach, but still then there is some scientific reason behind it. So use of also the taking long term of the estrogen pills for the youngness, it can also create the weaken the vein walls and create the weakening of the vein walls of the pelvic cavity. Then in physiologically, if we see that during this pregnancy condition, that is there is a significant increase in fluid and weight gain. It's very common. It is believed that this excess fluid and weight gain disrupt the vein and causes them to engorge with the blood. So over time of the vein become distended and a condition progress because the valves have been destroyed. So common development of the varicose veins, which leads to the asrugdar. Perhaps, so that's why the men do not develop this syndrome, this pelvic congestion syndrome. So what is the diagnostic feature of the pelvic congestion syndrome? That is the pain. So what type of pain? So pain is a bathic pain, pitic pain, and the kaphas pain. So if we see the bathic pain, it is the neural pain, and if we see the pitta's pain, then pain with tenderness, with inflammation, And so that's why it has been said that is the dull aching pain, that is the congestive type of the pain in low back, and the dyspareunia or painful fighters, then menstrual pain also, and the congestive dysmenorrhea symptoms are seen in patients. So, and the menstrual disorder like the menorrhagia, polymenorrhea are seen, may have associated with the similar to the IBS syndrome, that is the irritable bowel syndrome, frequency and urgency of the micturition. Then psychiatric and the emotional disturbance also we can see in patients, that is the more anxiety, and they attempted suicide, like, because when we are attending the patient, when they are coming and they are very failure to the treatment, then they are very much anxiety level is too high, that they will ask, madam मुझे कुछ ऐसे नहीं हुआ गया है ना, तो क्या मुझे कुछ खराबी नहीं है ना, कुछ खराबी नहीं है ना, तो उनका, क्योंकि एवरीबॉडी फॉन्ड ऑफ द लाइफ, सो उनका कहना का यही है कि मुझे कैंसर नहीं हो गया है ना, मुझे कैंसर नहीं है ना, तो ये हर बार ही पूछते हैं। ये हमको भी जब भी डॉक्टर होते हुए भी जब भी किसी को कोई सफर होता है तभी उसको फील होता है एक्चुअल फीलिंग्स क्या है। सो some poor patients, they are also, we can take the history that sometimes they are very much depressed, and sometimes they are also attempting the suicide also. So it is the so burning problem. So if we see the physical examination, if we do, then we can got there is the tenderness and pain in deep palpation of the ovarian points. Then pelvic, if we do the pelvic examination, then cervical motion tenderness and a ovarian point tenderness with the history of the postcoital arc. 94% sensitive and 77% the specific for the pelvic congestion syndrome. So you see this pelvic congestion syndrome, how it is the blood circulation is more in pelvic cavity, and due to that we can get this varicose veins in the lower extremity. So when we are getting the varicose veins in lower extremity, so we should know that there must be pelvic congestion. It is nothing but the pelvic congestion syndrome, and if we can clear this congestion, then we can cure the disease also. And we have a lots of the therapy like a Virechana, Mutrala drugs. They can easily, that is the remove the congestion from the body, and the patient can be cured also. So that's why the Bhagwan God has given the uterus is the middle, and behind it there is the rectum, and in the front of there is the bladder. So when there is more bleeding, if there will be the urination is more and there is loose motion, then positively there will be, and with this giving with some styptic drugs, then positively we can cure the positive factor. So that's why the Nidana Parivarjana is the main, and a Samprapti Vighatan, it is the main line of treatment in Ayurveda. So diagnostic testing for this pelvic congestion syndrome, UJ, USG, laparoscopy, CTRI and MRI, then venography also. And the treatment is medical and the surgical. So medical is the NSAID, oral pills, then the Provera and the GnRH antagonist. And the surgical, that is the ovarian vein ligation. So if we classified or divide this treatment line of treatment, one is the conservative management, that the medical management, and under this we can also add the panchakarma therapy like Virechana, Basti, Nasya, etc. Then some parasurgical like Agni karma, Khyara karma, etc. also. Then surgical, that is the polypectomy, myomectomy, hysterectomy, etc. So if we see, that is the how this avarana, to remove the avarana, that is what is the focusing in our Ayurveda. The treatment is highlighting, that is how to remove this pelvic congestion in case of the rakta pitta and the raktasya, etc. So there is the virechana, is the Charak is telling that virechana is the main line of treatment. And Kashyap is telling that virechana, it is also the virechana, which can remove the pelvic congestion and cure the disease. And then Susruta is telling that is the Rakta Pitta Harikriya. So Rakta Pitta Harikriya, for this there is also virechana is needed. And then if we go through the Sarangdhara, then it's advising the 𝘎𝑗𝑔𝑒𝑚, and we know that is a 𝘎𝑗𝑔𝑒𝑚 can also remove the avarana, the congestion. That means by this ENS and it after the ENS through the CNS, and microbiota influence the endometrium system biology to be normal. So Chikitsa Siddhanta, if we go through, that is the Rajakalacharya, it is nothing but a Rajakalacharya. It can prevent the Asrubdar, and it can prevent the Avarana also. So Saratrutu Charya, in Saratrutu it has been mentioned that do the Virechana. So in Saratrutu there will be the provocation of this Pitta, and to remove this Pitta, so that's why it has been our text is mentioned for the Virechan. We can give also Mrudu Virechan, we can give Nitya Virechan, or we can give the classical Virechan as per the patient, or as per the doctor and patient. They can decide, doctor can decide better, physician. So it is the jurisdiction of the physician, that is, but should give the Virechan during the Saratracharya for the to prevention the air. And this Virechana along with this Rakta Sthapana or the Sonita Sthapana, that the styptic drugs also can give, and the Pichabasti, which is mentioned in it is also very effective for the check the bleeding. And we so many cases when we are failure in the adenomyosis case, the can't check the bleeding even by the Taneja injection also. At that case we have given the Pichavasti and we got the result also in 2 to 3 cases. So Ayurvedic skill of management is mainly that is the check the bleeding fast when there is acute condition. So to check the bleeding, Sandhana, Skandana, Dahan, Pachan. It is the 4 measures which is mentioned by Susrut. And the surgery with the bleeding complications. Also the line of treatment is like Asrudda. Then Nasya in Rutukala also, which is mentioned for the, and it is telling that it is the complication and it can create the Jonis also. So in the Jonis also, it can take the, it will be the thinning of the endometrium. So in case of the endometrial hyperplasia and when there is excessive bleeding, then we can do the Nasya Karma, and we are getting the results also by this giving this Nasya Karma in the when there is the bleeding is not stopped. So Virechana, I have also told Virechan can remove the Nitya Virechan also can remove the pelvic congestion and helpful for the treating this Asrudar case. And this Basti for the Sadang Panya. If you go through this Susuru Sainta, that is Sadang Panya, which is mentioned Musta Parpata Gosira Chandana Dicha Nagari. So minus the Nagara or the Sunti, we can give the other 5 drugs. And we can add also Nakesar, in this case or Basanga we can add. So it is giving very good result in Basti for in the like Vital and Basti in case of the Asrudar. Also we can use some Rasayana drugs and which case there is the critical cases or the Dhatu.
Madam, the slide thoda आधा ही दिख रहा है. Is it the problem for everybody or me only?
But in my laptop it is a clear. whole the slides are visible, madam.
Okay, madam. Please continue. Okay, madam.
Okay. So if you see this congestion of the traffic congestion, what is doing? That is clearing the congestion, that is the traffic man. They can clear that is in which direction, which is the. So like that, if there is pelvic congestion, upon vayu is our traffic man. And if we will be Vatanuloman will give, then positively it can clear the pelvic congestion and you can cure the 𝘼𝙎𝙍𝙬. So some evidence of the treatment, that is some PG studies and some case reports, and lastly I will give you my prescription also. So the study one, that it is a PG study, and it has been done in 2019, that is the recent study one, that is management of the 𝘼𝙎𝙍 with 𝘼𝙎 and 𝘖𝑎𝑑-ghanavatī, an open label randomized clinical trial in IPGT and RA, Jamnagar 2019. The scholar was Pooja Chauhan, and he has done the MD study under my guidance. So in this case, 32 selected patients of the 𝘼𝙎𝙍 were randomly divided in 2 groups, and a total that is completed 28 cases. And the group 1, group A, it is the 13 cases we have given the 𝘖𝑎𝑑, followed by the 𝘖𝑎𝑑-ghanavatī. That is the 𝘖𝑎𝑑-ghanavatī, Basa, Rasanjana, Musta, Bhunimba, Raktachandana, Arka-pushpa, and Bilva. So 2 tablets 6 hourly we are giving in the bleeding period, and a 2 tablet BD after the bleeding, after the menstrual period, with anupan of the madhu orally for the 2 months or 60 days. And again B group, the same drug, that is 𝘖𝑎𝑑-ghanavatī, is giving in the same dose and the same duration we have given. But the result, if we see, then it is the in 𝘖𝑎𝑑 group, that is the 𝘖𝑎𝑑 followed by the 𝘖𝑎𝑑, it is clinically more effective than the group B, that is the 𝘖𝑎𝑑-ghanavatī alone, in the management of the 𝘼𝙎𝙍, and a group A giving the 86.8% result, whereas in group B, that is the 75.83% result only, overall effect. So then again we have further study we have done, and then we fortified, that is the 3 times of this 𝑏āsadi churna we have fortified it, and then we have given to the patient in the second study by the Ankit Garg. And in this case, the 34 patients we have selected in 1 group, in 2 groups. Then we have also get in group A the 89.30% result with this 𝘖𝑎𝑑, but when the 𝘖𝑎𝑑 followed by the 𝑏āsadi churna orally, and only the B group, it is the 74%. So we see that is the in 𝘖𝑎𝑑, when we have giving the Sodhan therapy, then we are giving the oral therapy or the styptic drugs, that it is the more giving result than that of without giving the Sodhan therapy. So I think it may be clear the this avrana and Vatanuloman, due to the Vatanuloman. So it is the better result we are giving, and the recurrence rate also less. So let us do in the day-to-day life of our practice. Then one more study, that is the critical study. It is not my study, but it is the study of this NIA Jaipur. That is the critical study on role of 𝘖𝑎𝑑 in the Samprapti Vighatana of 𝘼𝙎𝙍 with special reference to DV. Again, there is the 34 patients they have taken in 2 groups. In group A, 17, and group B, 17. And group A, 𝘖𝑎𝑑 by with the Pathya Ahara Vihara. And the second group, it is the Pathya Ahara only. And in 𝘖𝑎𝑑 for Dipanpachan Jirakadi Chuna, then Murchita Ghruta with Tibrut Avaleha, they have done this 𝘖𝑎𝑑. And if we see the result, then group A showed the 86% result, and whereas the group B showed that is the 14% relief only. And it is also clearing the clots and increasing the HP percent also. And even one, it is my experience that I have not recorded all this, but one student, she is studying in 10th classes, And she came to me that with her mother, that with crying that she is taking so many hormonal pills by the modern doctor and it is the failure. So then I thought that I have to give the Virechan. And as she is a very adolescent teenage girl, so when we were restricted with the diet, so many times she was crying and crying that you are not giving me anything to eat and all these things. But when we are giving the Virechan once, then she was relieved about the 90%. So she was very happy, and now also she is sometimes, so many times coming to me. So it is my sincere request to all the gynecologists those are present here. So please apply in your practice and convey to me also if you want. Then how this Rajakalacharya, it is helpful for this Asrubdar also. So see, it is the study of the 𝘎𝙬𝙗𝙂 madam. It is the in NIA Jaipur. And one patient that is the 25 years and complaining of early menstrual bleeding associated with the clots on first and second day. Then heavy bleeding since the 5 to 6 months. And USG and other investigations are normal. So by this giving this Rajakalacharya up to the 4 consecutive cycle with proper ahar, bihar and mansik bhavas, that they prohibited the tikhna kattu lavana diet during this menstrual period, and giving this 𝘎𝑉𝑠arna with meal with the cow milk, ghee, sali rice, java, barley to it during the menstrual flow. So result is profuse menstrual flow was returned to the normal within this after the 4th month. So case 2, that is, it is a adenomyosis case. It is attended to our OPD, and so if time will over, then please no. So this is a case. Age is the 34 years, and as the complaint of excessive bleeding per vaginal since 1.5 months. There is the continuous bleeding with the pain and the weakness. Then when we she has also the failure to conceive since the 15 years, and taking the allopathic medicines for that, after which she developed the adenomyosis. Then history of the irregular excessive menstrual bleeding. So marital history is a 16 years of the marriage, and obstetric history, abortion, 1.5 month of the gestation. So contraceptive history is nil, and a coital history is the last due to the bleeding. There is the 1.5 month, there is nil. So if we see the Rajaputta menarche, and these are not that much of the abnormalities there, but there is the irregular cycle and bleeding period 6 to 8 days. Stop only after taking the medicine, then the bleeding will stop. So color was a dark brownish red, and in that case, that when you do the sonography, then we see that the uterus is bulky with the severe adenomyosis, and moreover the posterior wall. So endometrial interface indistinct, and uterocervical length is the 12.4 centimeter, HP is 10%. So in this case, as there will be 1.5 month bleeding is continuing, so first of all, we have given this treatment for this styptic, that is the oral styptic like Pusyanuga churna, Lodhra, Khadira churna, Basa, and then Raktastambhaka. So then a Rasayan churna also we have given, and Chandra Prabhati for the anti-inflammatory. So that's how you have choice. And then local for the Pichu, that is the Suddha Spatika, and then Nasya by the Basa Swaras. So by giving this in the Kuttajadi, Jogavasti you have given, and by giving this treatment, then duration of the treatment we have given this 10 days, and so within this period Then we got the bleeding was stopped after the 7 days of the treatment, and then we have virechan was planned and do the virechan to regularization of the menses and the long-term result, and we have got this good result that bleeding was been stopped and the menstrual cycle was the regular. So this is the case 3, that is the uterine fibroid. We have diagnosed that by the USG, and the patient complained of the early and heavy menses with pain in abdomen during the menses. The whole history is the 2 years, and then the dyspareunia, gas trouble, heaviness in abdomen, constipation, and headache was there. And the past history, it was the OC pills regularization and menses is the congestive of the 3 month she has taken, and the interval it was the menstrual interval 15 to 20 days, and the amount of flow, that is the pad which she was taking, that is 6 to 7 pad per day, which is fully soaked. So then HB percent was 8.2%, and LFT, RFT, it is the normal under, but USG when we have done, then the uterus bulky, it is the 190 cc, the volume, and the fundal region, there was the fibroid of the 38 into 40 into 40, that is the fibroid size, and the lateral side there is another one, that is the 8 into 21, then it is only the 4 mm. So the treatment was planned. First, we have given this 𝑘 Deepan Pachan with the Sunti Guduchi Haritaki, then Snehapan with the Triphala Ghruta, and then Virechan we have done by through the Tribrut Ableha and the Triphala. Then after the Virechan, then the Palasa the Jogabasti, it has been given for the 8 days. Then oral therapy, it is the Khadiraashtak with the Punanavastak Vatha, Gomutra Haritaki, Arogyavardhini Tripla and Suddha Tamkan. Then Gokiradi Google, if we see that is the menstrual cycle become the regular with the moderate amount, duration, it has flow become the 5 days, and the interval it is the 26 to 27 days, and the pad it has been reduced from 6-7 to 3 to 4. Then pain was absent, and weakness was mild, and reduced the dyspareunia. So USG finding, before treatment it was the uterus was bulky 190 cc, and after the treatment it becomes reduced to the 134 cc. Then fundal region, the fibroid, it was the 38, which was 38 40 into 40, it become reduced the 38 to 35 in the fundal area, and then in the lateral area, that is which was the before it 18 to 21 mm, then it become reduced to the 15 into 18 mm, and it was 4 mm, and HB is the 8.4. So if we continue this, then it will be giving the the next sitting, 2 to 3 sitting of the Virechan and all these things, then it may be the good result. And so another thing, that is the in uterine hyperplasia case, that is the case 4, that is the 46 years old lady, housewife by the occupation. She has the complaint of heavy irregular menses, and she has in USG, which have done the thickened, it was the 14 mm and the thickened endometrium with the cystic hyperplasia with moderate adenomyosis. So in that case, we have given the oral therapy, the styptic drugs along with the Chandrapavati, Khadiraashtak, Kwartha and Dinasya of the Satpuspatel. Then we have given the Virechana Karma, then Virechana always we are giving, advising the Sunti Guduchi Haritaki, which is the Tridosh Samak also. So Deepan Pachan along with the Tridosh Samak, and Snehapan with the Panchatikta Ghruta, Virechan with the Tribrut Ableha, and then Palasadibasti for 8 days along with the oral medication. Then Uttarbasti with the Apamarga Khyar Tel 2 to 3 ml 3 days for 2 cycles. So after Virechan, the Khadiraashtak Kwartha and Saptavinsati Google has been given. So the result is the bleeding was reduced after the nasya along with oral therapy, and the total the checked out after the Virechana karma. Then mens was regular and the amount of the bleeding reduced after the completion of the therapy. Dyspareunia and weakness was relieved. And on USG findings, that before the treatment the bulky uterus was 144 cc, and after the treatment then it was the 110 cc with the mild adenomyosis. Then ET, which was before the 14 mm, then it becomes the 6 mm. And the thickened endometrium with the cystic hyperplasia with the moderate adenomyosis, then it was become the within the mild adenomyosis, and the left ovary it was the 8 cc and right ovary was the 7.2. So this is the one of my prescription that which I am advising so many patients. Musta, Arjuna, Asoka, and Gokyu. So it is the Pitta Virechaka and the Mutra Virechaka along with the styptic. That is the under the Lekhan also. So Asoka and Arjuna, and then Chandraprabha Bhatti, 2 tablet BD, Phaltrika the Quath and the Punanavasta Quath also. So this is which case that the failure cases of the medicines is not responding. In that case, one of our sister, she was suffering from the typhoid fever, and when she was taking the drugs, then after she was the menopausal age, after the taking the medicine, then she got the excessive bleeding, and the bleeding has not been controlled till 1 month by taking this styptic drugs from modern side. Then I have after the 3 to 4 days she has taken the drug, then she told that my bleeding has totally stopped. So I think we can also use in so many cases, large number of cases, and see that it is the effective prescription or not to validate it. So Ashrubdar or the that is abnormal uterine bleeding. If we see the Ayurvedic concept in short, that is it may be the Avranjanya Vyadhi, that is the Prabhutapana, and Artavadusti, that is the Artavadosa Pramihastu Vyana Apana Prakopajaha. So if you take, then that is the Vyana is the responsible for the blood circulation, Raktasrava and Svedasrava. Mansik Bhavas also we have to reduce. Then Vegdharana. For the those who have the habit of the Vegadharana, we can reduce or we can treat it by giving this Tripla or Vatanuloman drugs, and then we can also reduce the incidence of the endometriosis and the adenomyosis. Then the Rog Nidan like Jani Vyapat, then the Dusprajata, Garbhasrava, Arbuda, Gulma, also we can treat accordingly. Then the Rakta Pradosha is like Kamiha Pradaratmitra. So we can give this that is the Sonita Mukhyana or the Rakta Mukhyana also seasonal we can also do, or the Rakta that is the Stanya Sodhanagana also we can give in this case. Then take a message. For a successful management of the unstructural Ashrubdar, then diagnose the cause first, and then there is the excessive bleeding, then stop the bleeding. And anytime the functional cause can be converted to the structural. So for timely intervention we should do, remove the congestion by the Virechana or the classical Nitya Virechana or Vatanuloman or by giving the Mutral drugs. Then Rakta Sodhan drugs should be given, Pitta Samaka, Vatanuloman. Batta Pitta Harikriya. Then can give the Rasayan therapy also for this Dhatu Khayajanya Lakshana. Then the Satta Bhaja, that to reduce the stress, and then for the preventive purpose remove the pelvic congestion in Sarat Rutu by giving bath, the annual Virechan, Nitya Virechan daily till the normal menstruation. Weekly Virechan by Abhipattikar Churna Phaltrika, then Rajakalacharya. So if we do, then we can also prevent the Ashrubdar and you can treat the Ashrubdar very successfully. So Pivet Agni Vibhudatam Nacha Vegan Vidharayat Agni Diptikaran Runam Roganam Samanam Prati. So Agni, that is the Pittantargata Agni and Raktantargata Pitta, and the whole is controlled by the Vayu. So if you remove the congestion, you can remove the pelvic congestion and you can remove the causative factor of the disease, and we can treat very successfully the 𝘼𝙎𝙍. So thank you one and all to giving me chance to share my thoughts in such a platform. Once again, and thank you one and all and organizers and their team. Thank you. Namaste.
Thank you very much.
Hello.
Dr. Parashar, बोलिए.
Hello. Hello everyone. Myself Dr. Neha, and I feel very lucky to be a part of this webinar as a coordinator. Thank you, Dr. Lakshmi, for such a wonderful session. Ma'am, you have touched all the corners and you have explained the topic so thoroughly. I am sure this will be fruitful for all of us. Now, the house is open for queries. Some queries has been posted during section also. We have got a question in the chat box. Ma'am, how can we proceed the case of AUV due to adenomyosis? Hello, ma'am.
Okay. Am I audible? Am I audible?
Yes, ma'am. You are audible.
Okay. So I have shown you some 1 to 2 case studies about the adenomyosis. So first of all, we have to diagnose that it is the adenomyosis and what is the site and what is the grade, that it is the mild adenomyosis or moderate or severe adenomyosis, then what is the size of the uterus and what is the volume of the uterus and what is the chronicity of the disease also. So accordingly we can plan, and in that case not only the 𝘼𝑎𝑐 therapy, but first if it will be excessive bleeding, then our main aim to there is the stop the bleeding, and then we have to remove the causative factors and then remove this avrana also. So in that case we have to plan the 𝘼𝑎𝑐. It is not the which is the drug we are giving, that is the dipanpachan. Then we should add musta here, that is the guduchi, sunthi, guduchi, haritaki and the musta for the 5 to 7 days. Then we have to choose the what type of the snehapana we have to give. We have to give, this is the panchatikta ghruta, even tripla ghruta also we can give. And then after this, then we can take the 𝘼𝑎𝑐 with this tribrut ablayam and the tripla. Last, which is mentioned from the Granthi and Abhuda Adhikar. So in that case, if the basti and and some styptic drug we can continue along with this prescription which I have been showing. So but it is a long-term treatment, minimum the 6 months. 6 months to 1 year sometimes it will take. But if it is a moderate, then it can be reversed to the mild. If mild, then it can cure. But in case of the severe grade, so it is very difficult to treat it. And symptomatically the result, but for the cure, I can't be tell that that I can cure it because it is depend that how many years he is suffering. Okay.
Yes, ma'am.
Thank you so much, ma'am. Then the next question is, how can we differentiate Rajovriddhi and 𝘼𝑎𝑐?
Please repeat the question again.
Ma'am, how can we differentiate 𝘎𝑗 and 𝘎𝑠?
Okay. How we can differentiate the 𝘎𝑗 and the 𝘎𝑠? Really, it is a very nice question, and always it is coming in this examination also. So if you see, the symptoms are same. That is ativrudhdhau daurgandhya. Exactly, it is the artava vruddhi lakshana. But in 𝘎𝑠, so 𝘎𝑠 is a disease. And the artava vruddhi, it may be the physiological. That is the dhatu khaya vruddhi lakshan. It will come under it. So it is a physiological entity, whereas it is the pathological entity. And maybe the complications, all the things can come.
Thank you so much, ma'am. What is the ma'am? The next question is, what is the indication for surgery in 𝘎𝑠?
Okay. What are the indications of the surgery? So there are surgical diseases are there. So when the fibroid, if fibroid is more than the 5 centimeter, we can't by this panchakarma therapy or by this conservative treatment, we can't. So in case of the fibroid also, and in the severe grade of the adenomyosis, so in that case also we can't. In carcinoma case, so in case of the multiple fibroid with not responding to the medicine, so in that case, and even the uterine ovarian tumor also, and the possibility of this suspecting the malignancy, in that case you have to give this or the endometrial carcinoma, we have to do the surgery and advise the surgery.
Thank you so much, ma'am. Ma'am, the next question is, how nursing is useful in DUV?
Pardon? There is some disturbances occurring, so that's why I think I am not exactly hearing the question. So please repeat it.
Ma'am, how nursing is useful in DUV?
In DUV, okay. So we know that the hypothalamus, pituitary, ovarian, and endometrial axis, it is controlling this whole regularizing the menstrual cycle. And in 𝑛ASH, it is directly the influence. And not only the hypothalamus, but the whole this means that is the response. So it is due to this, it is normalizing the indicating this stimulating this hypothalamus, that is the to pituitary, that to it is normal function of the pituitary ovarian axis. So that's why it is the nurse is it is very effective in the case of this 𝘎𝑠 or the dysfunctional uterine bleeding.
Sujata Gonu and Ankita Meena, please mute your mics. You're creating disturbance in the session. Sujata and Ankita.
Okay, ma'am. Thank you so much, ma'am. There is another question. What is the management of postpartum DUV patient is suffering from excessive bleeding since 3 months?
Postpartum DUV patient. So please, yes, please mute others' mic so that there will be so much disturbance is occurring. So please mute yourself. Again, it is coming. Some sound is coming. So, sound I am hearing, or others are also hearing.
Sujata Gonu, please mute your mic. Sujata, Dr. Sujata. I think she's not listening.
Okay, so in pardon, please repeat the question.
Ma'am, what is the management of postpartum DUV patient is suffering from excessive bleeding since 3 months?
Okay. So first of all, you attend the postpartum case. So
Yes.
in case of the postpartum case, we have to undergo what is the status of the uterus. Uterus is full contracted or not? And if it is the fully contracted, the same medicine we have to give. With this Nasya Karma can give, can Basti can give. So when there will be the any surgical cases also, what is Sushruti is guiding, that you have to give the medicine as per the Asrukdar. That is the this is the Dahana, Pachana, and there is the Kwatha and Hima. All these we can give, whatever according to the patient we can give.
Okay, ma'am. Thank you, ma'am. Ma'am, the next question is, in Nitya Virechan, स्नेहपान करना जरूरी होगा or we directly go for Nitya Virechan?
In case of the Nitya Virechan, there is the two types. We are doing. I am doing the two types. When there is, we are giving this katuki with this tripla, then we can add some amount of this eranda tela or the castor oil. We can give, or with the ghruta we can give also. So it will be because if you want to take the long term, then we can add. Otherwise, sometimes when there is bleeding and up to the within the 1 week, then it is responding. There is no need.
Okay, ma'am. Thank you, ma'am. Ma'am, the next question is, can Asrikdar be treated with the Shaman Chikitsa only?
Only we can take. If it is the disease is very it is not chronic, and it is very, the symptoms are taruni, what is mentioned, that is, it is the not that much the complication is there and not excessive bleeding, then and it is responding to the medicine and to the according along with the patya, then we can treat by this medicinal treatment, conservative treatment we can give.
Thank you, ma'am.
From patient to patient. Huh?
Yes, ma'am. Thank you, ma'am. Ma'am, the next question is, what is the mode of action of Pichavasti in Asrikdar?
And in which case we are giving the Pichavasti?
Ma'am,
in which case it is the indication of the Pichavasti?
Ma'am, in Asrikdar.
In Asrukdar it is giving, but actually the Pichavasti, which case it has been indicated by our text.
Rakta pravahika.
Exactly. So it is mentioned in the Rakta Prabahika. It is giving for this. So it will not only the Prabahika. When we are giving this Asrukdar case, it is also getting the result. But how it work? Because now Basti is the 50% of the Chikitsa. And it is the site of the Apan Khetra, and the disease is the derangement of Apan Vayu. So it may be remove the pelvic congestion, and due to this we are getting the result.
Thank you, ma'am. Ma'am, the next question is Stambhan Chikitsa is useful in Asrikdar with reference to pubertal menorrhagia?
Exactly. First of all, we should not switch up that other treatment. We are first of all giving the Saman therapy or the conservative treatment. And if it is not responding, then we can take other. Otherwise, it will be, if it is, because it is vary from patient to patient, and it is the how the drug is responding. So it is also depending, no?
Yes.
It will depend upon the physician also, and but so many cases we are getting good result also. Any question, or we can stop? I think it will be better the next that the panel discussion. If it will with panel discussion with all the means other the specialists, then it will be more fruitful and more the your cream and the ghee will be come if it is possible. So after one topic, the next topic should be next session should be the panel discussion.
Okay, ma'am. It's a pleasure, ma'am.
Okay.
There are no more questions. Dr. Neha, are you there? Dr. Neha?
Hello.
Yes, Dr. Neha.
Sir, shall we conclude our today's webinar?
Yes, sure.
Okay, sir. Ma'am, it's my pleasure to propose vote of thanks on the behalf of NEMA-OBGYN Society. I want to express my sincere gratitude to Dr. 𝘼𝙎𝙬𝙼 ma'am, who spared his precious time to enlighten us from such a busy schedule. Ma'am, talk about a stricter within the preview of Avrana. The concept of Avrana is unique and most difficult condition in Ayurveda to understand and analyze by a physician. Ma'am explained this topic in such detail. It will definitely help all of us for easy diagnosis as well as to attain Chikitsa Safalta. Thank you so much, ma'am. I would further extend hearty thanks to all the dignitaries for their continuous guidance. My deep thanks and appreciation also goes to all those who are live here with us. Hope to see all in next webinar of our session. You all made today's event a great success. Thank you so much, ma'am. Now you all can sign out. Hello.
Hello. Thank you, ma'am. Thank you very much, ma'am.
Hey, welcome to all of you, and thanks to all your organizer and team that giving me opportunity to share my thoughts in such a platform. So thank you all.
Thank you,
Yes.
Lakshmipra madam. It was very enlightening talk, and we got to know the good comparison between the pelvic congestion and other avarana. So that was a unique addition to our knowledge, and I'm very thankful to you for sharing your clinical experiences regarding cases like adenomyosis and fibromyomas, because generally it is thought that Asrugdara will treat where there is no pelvic pathology, but by your experience, even women who are having a pelvic pathology like a fibromyoma or adenomyosis can respond to this our medicines and our therapies if we apply our concepts properly. So that is some take home message that the participants have got from your talk, and they will definitely be encouraged to try it out successfully in their patients. So thank you so much for sharing your clinical experiences with us, madam. We look forward to much more talks from you and gaining from your expertise and experience in this field of Prasuti and Stiroga. Thanks a lot, madam.
Okay, most welcome. Always welcome.
Yes, madam. Thank you so much.
Okay, namaste.
Namaste.
Namaste. Namaste.
Namaste.